Hey, what's going on? It's Dr. Drill here. Dr. O, whatever you want to call me. Aaron Sebastian Oberst. OB. Doing some quick musculoskeletal primers here. Give everyone an appreciation for some of the potential pain generators to be aware of. Let's say somebody's got neck pain. Okay, so here we go. First of all, you could have a big ass dent in the back of your head here where, I don't know, this is a deceased individual, not to speak ill of the dead, but he must have gotten friggin' hit with a pickaxe or something there. Terrible. Okay, so if we go beneath the surface, deep to the epidermis, the skin, you can see that we have different layers of muscles here. Alright, so first and foremost, we have the trapezius in the center here. So that's this entire muscle here. Stretches from the back of the head all the way out to the shoulder. And then it goes all the way down, highlighted there. Trapezoidal in shape. Attaches to the spine, attaches to the shoulder, attaches to the back of the head. And so if you have a problem with the trapezius, you could just have a tight trapezius. You have a trigger point. There's oftentimes trigger points right in the mid belly, right where these upper fibers. Right here you can see the muscularity going up towards the neck and head, where it goes out towards the shoulder there. These trigger points, which are like little pieces of gristle in your steak, focal areas of what we call hypertonicity, muscle tension. And everybody's got these to some degree, or to one degree or another. Sometimes the knots can become so angry that they become active trigger points versus what we call latent trigger points. That means that they're just kind of dormant. It's just a knot in the muscle. It's not making or breaking you. It's not ideal, but it's not symptomatic. But with stress and ergonomics and various postural faults, challenges like that, stress and tension can activate those trigger points, and then they can refer. They can go down the arm. They can go up to the head, cause headaches. They can cause the entire muscle to just kind of like be working a lot harder than it needs to. Okay, so there's the trapezius, and then we go deep to that, and we have layer upon layer of deeper muscles. And this is one of my favorites right here. Let's see, where are you at? Yeah. So this muscle right here, the levator scapulae. So that is notorious. You can see that it attaches to the top of the shoulder blade or the scapula, highlighted in blue there. And then it's going to attach to the neck muscles, deep to the neck muscles. The sides of the neck bones, the vertebrae. And so those are the two attachment points. You can see that they break off and it'll attach to this vertebrae and the one above that. So the first several vertebrae, they're going to attach to that and then attach to the shoulder blade. So it's yanking between your neck and shoulder all the time, and it friggin' hurts. And so almost everyone I've ever laid my hands on in peacetime has a knot right here. Levator Scap trigger point, and they can get really angry and become active trigger points all the time, cause headaches, cause neck pain, cause all kinds of issues. So that's one of my favorite clinically most often encountered culprits to neck pain and headaches. And then you go even deeper, see all these tiny muscles that attach to the spine, and they go all the way down the spine. Hunters would call them backstrap muscles. See them? We call them the erector spinae. So they go all the way from the back of the head all the way down to the low back. I'll show you those lower attachments. Look at them. They flank the center of the spine. They finally anchor right here on the sacrum, the tailbone. Okay, the next clinically relevant muscle I like to talk about is the suboccipital muscles. So you see a little triangle, goes like that, and so are these various muscles. That attach from the spine very high up to the skull. You can see, for instance, these ones right here. And they got funky names: Rectus Capitis posterior major. So rectus means straight and capitis means skull. So it's a straight muscle that attaches from the skull to the spine. And then you got a rectus capitis inferioris, obliquus capitis, and then this one here, obliquus capitis superior. And what's this one here? This is the minor, right? Rectus capitis posterior minor. So this suboccipital triangle, as they call it, you can see that when I want to, see, I can make it all muscle. If I swipe over, you'll see that there are veins, arteries, and nerves that are coming out of that triangle. So it kind of can strangulate, in a way. You can imagine how these very small but powerful muscles up in where the neck meets the skull, they can be pressed upon. They can become angry themselves, the muscles. They can cause, if they're too tight, they can cause mechanical dysfunction. And then the nerves that come through there, you're going to see that they come right to the posterior of the head. So the greater occipital and lesser occipital nerves, they're going to come right up to the back of the skull. So if you ever have neck pain, tension, headaches, stuff like that, these muscles and the nerves that power them and that pass nearby, they can be at fault. Okay, they can be angry. They're tight in friggin' everybody, my friends. Wouldn't you say? There's a condition called student syndrome, or tech neck, where all these muscles in the back of the head and neck, they become so tight because our head is always forward, right? Our head is always forward, or looking down, looking at the work that we're doing, looking at the cell phone or the friggin' laptop, or staring into a PC. Some of my favorite muscles that can get angry. So what do? What do I do with them as a doctor of chiropractic? I stretch these muscles. I massage these muscles in a very specific way called myofascial release. So I bring them through their normal range of motion while stretching them. And it can be very effective, and that'll deliver a very safe, effective, gentle manipulation to the joints. So if we talked all about these muscles, and they're very, very important. But let's look at some of the joints now. So this is the cervical spine. I'll get rid of these nerves just a moment. So right in there, all these structures here, those are the actual bones of the neck. And they're very delicate and very small, but they have a giant bowling ball sitting atop them, so they take a lot of force, and there's also a lot of mobility, right, from the required of moving your head around. So these vertebrae can oftentimes get stuck. I should introduce you to the joint line, which are these little bevels right here and here. So as the head and neck rotates, these are the joint lines there, and they can kind of glide and turn, and there's different ranges of motion, right? So there's rotations where you turn your head to the left and right, and then there's lateral flexion. Let's see if I can mimic that. Lateral flexion is where these all bend in arcing fashion, side to side. Like bring your left ear to your left shoulder and right, same deal on the right. And then extension is where you tilt your head back, and then tucking your chin to your chest would be flexion. So there's these complex ranges of motion involved in the neck, and sometimes the neck can get mechanically just stuck. Maybe a little rust on the hinge, some arthritis, maybe some discs can get angry or inflamed between the vertebrae, and of course the nerves. If I introduce them back into it, you see that between each of those vertebrae there's a nerve that comes out, and that those nerves can get irritated, inflamed, pressed on in some circumstances. And that can help relieve the pain, alleviate the problem. So it's pretty cool. So that's a primer on the neck. Let's look at the anterior neck real quick. Very complex. I'll have to do another talk on the TMJ, or the temporomandibular joint. Believe it or not, this big wad of soft tissue on the cheekbone there, on the mandible, rather, that is a gland. That is called the parotid gland. It's your number one salivary gland, your biggest. Let's go around the anterior neck. Look at all those veins, artery, and nerves that are coursing every which way. I'm going to get rid of them for a moment. We'll go back to the muscles. So look at all these various muscles. We got muscles on the side. A lot of times, this is a muscle called the temporalis. All right, that's right in your temple region. And that's one of your muscles of mastication. So when you chew, you're doing so with that muscle and this muscle. And this muscle. This should be the masseter. There you go. And so I had a guy, it's an interesting story, I had a police officer in the other day. He said, I was working on this area, and there can be little nodules, little trigger points, just like in any muscle. And I was working on the sinus sites and working on these head and neck muscles. And he said, it's great, my head doesn't even hurt. I had somebody that kicked me in the head the other day. He was restraining somebody who was having a mental break, grabbed one leg, excuse me, and the other leg was not held down by his partner, so he got kicked in the temple. But he said it didn't hurt when I worked on him there. I'm glad to hear that. So there is a muscle. Let's see. So there's all these muscles in the front of the neck here. You see the various layers of them. And there's a thyroid gland in the center. It looks kind of like a butterfly. Very important. Providing energy to every cell in the body. Where's my friend? I'm looking for the sternocleidomastoid. There it is. The sternocleidomastoid. So there's a condition called torticollis, which can be either congenital, in other words, an infant comes out, the fetus comes out, and it's kind of curled up there in a stiff neck posture, and it comes out and it's had a shortened neck muscle for a while, and that living in that cramped up space. So it doesn't want to, its head doesn't want to be positioned properly. So with some gentle encouragement, maybe some heat, some gentle rehab, you can train that to bounce back. Babies are very, very pliable, very adaptable. Okay, but in the humans, there's something called Saturday night palsy, where you'll have somebody that'll sleep on a couch. Let's say you go to visit your parents or somebody in another state for Thanksgiving, and you wind up sleeping over, and you sleep on a couch, and you're not in an ideal position. Your head's all cricked up. So this muscle can become angry, and then when you get up in the morning, you can't turn your head. This is often at fault. The sternocleidomastoid. There's an awful lot that goes into managing head and neck pain. As I mentioned earlier, stress, physical and mental stress, particularly mental stress these days. Everybody holds their stuff. People say, oh, that's where I hold all my stress, right on my neck and shoulder. Yes, you do. Yes, you do. You and everyone else. So here's all those various layers of muscle, tendon, ligament. We can have trigger points. We can have pinched nerves. We can have mechanical dysfunction, disc herniations, arthritis in the neck. And it can be quite conservatively managed. So relieved with very safe and effective chiropractic care. Nothing too dramatic, okay? Hear about people coming in my office saying that, hey, I went to this other guy and he really ripped my friggin' head off. Like, I got to deal with this shit all the time. But it creates a niche for people who are gentle and respectful with the care that they render. All right. First thing you got to do is got to meet people where they're at, their comfort level. People will tell you, and you can pick up on whether or not somebody is on board for it. Are they going to be able to handle manipulation? Is it appropriate given the circumstances? Do you have x-rays, MRIs? And beyond that, you got people who are older, younger, or bigger, smaller. And everybody needs to feel comfortable. And since it's pretty much instinctive for people to guard around their head and neck, you have to put them at ease. You have to relax them and apply only the amount of force that is appropriate and the safest, most effective techniques. That is my little spiel, 20 minutes worth, on the neck and head, headaches, tension, migraine, you name it. I've dealt with all of it. Somebody get hit in the back of the head with a pickaxe, I can't help you. Yes? So give me a call if you're hurting. Fix you right up.